Well, first of all, thank you so much for inviting me up here. I always love coming to the North East. You've shown leadership for over 20 years in this area, and you continue to show leadership. And to speak after such a stellar group is just amazing. And I, particularly after two of my real heroes, Ailsa, who's set up and has continued to run Fresh since 2005, but also all her team and all of you here, because Fresh only exists and continues to exist, as Ailsa pointed out, because of the commitment, first of all, of the public health professionals and the primary care trusts, and then when the transfer to local authorities happened, from local authorities. And that will and is continuing. And, Liam was a transformational CMO. He kicked off the argument about the need for legislation on smoking in public places and continued to fight for improvements on smoking policy throughout his time. But now he's come back, and we're so delighted to see him back as chair of the North East and North Cumbria ICB, building that cross-sector working on prevention, which is going to be so important going forward to making smoking history. I tried to input my words because I think you here today symbolise for me three things: commitment, consensus and collaboration, and that's what's going to drive us forward and get us to where we need to get to. And it wasn't always a done deal. People say to me, oh, well, smoking, it's done and it was easy, it's different from other things. Well, look at the 1990s. In the 1990s, smoking rates had gone down considerably, but in adults, it sort of flattened off. And it was because the tax rises, which were the only real government policies in the 1990s, increasing the tax on tobacco above inflation, were undermined by the growing illicit market fueled by big tobacco. By 2000, up from below 5%, 20%, that's 1 in 5 cigarettes smoked, and 8 in 10 roll-your-own cigarettes were illicit. And the price was about half that of tax paid. And that particularly was undermining of tobacco control policy amongst the poorest and disadvantaged, and also amongst children, because people who sell illicit tobacco don't have any compunction about selling to children. And we can see that in the data here. On child smoking, when the government started the survey in 1982, 1 in 5 children 11 to 15 smoked. It began to go down in the 1980s, and then in the 1980s, and then in the 1990s it went up again. And by 2000, it was still 1 in 5 11 to 15-year-olds. Why? Because all the voluntary agreements on advertising were ineffectual, TV sponsorship. In 1987, there was a ban on TV advertising, but they just went on to sponsorship. And the sponsorship was equivalent to 14 30-second ads a week. 90% of these were on the BBC, the most watched channel. And in 1990, more than half of children who smoked daily were able to buy single sticks. So what a surprise, smoking had actually gone up. The manifesto commitments were weak. When Labour came in, the only commitment was to ban tobacco advertising, and they went back and forth on that. It took years to get them to do it, and in fact, it was only in response to the EU. In 2001, all they said they'd do is offer the world's best smoking cessation services. Important, but not enough. All the rest of it you can see, but that's not what happened. Successive governments delivered, because in office, the pressure from the CMO, from the public health profession, from academics, clinicians, all of us, made a difference. We got the ban on smoking in public places, which Labour in 2005 said it wasn't going to go ahead with, not in pubs and clubs. We got standardised packaging. We got putting displays out of sight. And as you can see, that 1 in 5 had fallen by 2021 to 3%. That's 3 in every 100 11 to 15-year-olds who smoked. And our track record was the best in Europe. So in 2006, the year before the smoking ban came in, our smoking rates were slightly higher than the European average. By 2020, they were half. And that's because we implemented EU+++. So there were things that the EU required, but we went further. And I've highlighted in bold where we went further. I won't go into great detail, but the point is it was a comprehensive regulatory structure implemented by successive governments and backed up by stop smoking services and behaviour change campaigns. And we went faster because of you, because of the people in this room and people all around the country, Backbench, crossbench party parliamentarians were absolutely essential. They were the ones who pushed governments to go further, but they were supported by civil servants providing evidence-based policy advice to politicians, academics and clinicians, Smoke-Free Action Coalition members, many of you in this room will be members, the public health professionals, and Liam as the CMO was the spearhead of that, regional tobacco control organisations. Fresh was the beacon, and two others were created in Fresh's image, Smoke-Free Northwest and Smoke-Free Southwest. Both went after the transfer to local authorities. It was only in the northeast that local authorities here sustained that regional structure. And now we're hopefully seeing it spreading out. The model that's been put in place in the northeast and North Cumbria, in North Yorks and Humber is now being developed, and there are other regions where they're looking to what has been done here and thinking we could do something similar. Local government, committed councillors backed up by equally committed public health professionals in environmental health and trading standards, and stop smoking services and tobacco control leads. In the campaign for the smoking ban, the people working in stop smoking services and the tobacco control leads were absolutely vital around the country in helping build public support and understanding. But we're still not on track to a smoke-free 2030. On current trends, we won't achieve it till at least 2039 and probably another 10 years for the most disadvantaged. So we need a new national strategy. And we set that out working with academics and clinicians, people like Anne McNeil and Robert and others, to develop the all-party group report in 2021, which the Khan Independent Review last year, basically, we're very glad they stole a lot of the ideas from the APPG. They were very good ideas. And some of them have been put into place, but not enough. And ASH, working again with the academics, have put in successive budget submissions, responses to the youth vaping consultation. There's good base of evidence-based policy that can help create a smoke-free future, but it needs to be implemented. And our top two priorities, Ailsa asked me to talk about this at the moment, are firstly funding, because actually what we need to do is help those who still smoke to quit. That has to be the priority. UK-wide, there's over 6 million. And it's highly addictive. They need help. The behaviour change campaigns, which have been cut to the bone, and the treatment are vital. And that can have, as Neil pointed out, who, like his namesake, Neil O'Brien, the Public Health Minister, understands all of this, is crucial for reducing pressure on the NHS and social care, for cutting the cost of social security, improving productivity in regions where that is absolutely vital. And to kickstart the debate, we need a government consultation on raising the age of sale. Now, a story in The Guardian on Friday, which many of you will have seen, said that the Prime Minister is considering this. He's considering the New Zealand model. But there needs to be a public debate. The lesson from the ban on smoking was that it was that public debate that drove government to do the right thing, and that, as a result, meant that once the legislation was implemented in 2007, there was 97% compliance from day one. Now, compare that with France. In the 1990s, France implemented a law to ban smoking in workplaces. They didn't tell anyone, they just passed it, and no one stuck to it. They had to do it again after us in, I think it was 2009 or 2010. Second time round, they had the public debate that is important for this sort of social legislation which requires the community to support it, and it went ahead. Now, we need a consultation on raising the age of sale. It will raise the issue of why is smoking different? Why is it so harmful that we need to treat it differently from other things where 18 is the age of majority? And it's under discussion by both government and the opposition. We, in this room, need to push government to do it. So where are we now? We have political commitments to a smoke-free future. You know, the Conservative government committed to a smoke-free 2030, 5% or less. But they haven't put in place the funding or the measures that will really deliver, or only partially. The 2022 Khan review estimated what was needed was another 125 million. We think it will be more than that, but actually all they've committed so far is under 30 million. And on current trends, as I said before, we're 9 years behind. Labour, in its health mission, has committed to a smoke-free Great Britain. Great, but no delivery date, no new funding, and measures announced so far to deliver it are far from ambitious enough. So there's been a real-term cut to tobacco control. I don't need to tell people in this room that. 47% real terms cut since the transfer from NHS to local government. Nationally, the investment in national behaviour change campaigns fell between 2008 and 2018 from over 23 million to around 2 million, and the 2019 to date spending has been under 2 million a year. It's only in the northeast and some other parts, there's been some work in GM, obviously with GM Health and Social Care Partnership, and some in Yorkshire, but basically national level there's nothing. And the public purse is denuded, new sources of funding are needed. So that's the rationale for a levy on big tobacco. This is an industry which makes around 900 million a year profits and on average 50% net operating profits compared to around 10% for UK manufacturing. Why is an industry which makes products that kill people allowed to make such excessive profits? It's an issue of social justice. And it's an issue of public finances too. The tobacco industry says, oh, well, smokers pay taxes. That weighs up against the cost of the NHS, but it's not just the cost of the NHS, it's all the other costs we talked about earlier. And all main parties have made promises about the levy. The Conservative government, when it announced the smoke-free ambition in 2019, promised to consider a polluter pays levy, but has never done anything about it. And the Labour Party and the Lib Dems, and in fact all parties, supported the Lord's Amendment to the 2022 Health and Social Care Bill, requiring a consultation on a tobacco manufacturer's levy, but the government refused to. It was passed in the Lords, but rode back in the Commons. So what would this do? It's justified by market failure. We've got 4 tobacco transnationals who control over 95% of the market, who make excessive profits. It's something that there's a model, really, from the pharmaceutical pricing scheme, which has been around since the 1950s. And as Simon Stevens, the former chief executive of the NHS, said, well, if we can do it for pharmaceuticals, we can do it for tobacco. And it's much simpler. The pharmaceutical industry is really complex, making complex products, and you need to account for the cost of research and development. Tobacco is for companies. We don't want them to research and develop new and exciting tobacco products. We don't want, they're not allowed to promote and market their products. So all you factor in is the cost of production and the cost of distribution, and they should only make a limited amount of profit on top of that. And the rest of the money should go into the Department of Health to pay for tobacco control measures to deliver a smoke-free 2030. So what's needed? National action and funding is an essential foundation for your successful regional strategy. You're doing amazing things, but we need this change in the overall regulatory structure. We need more money to be flowing into the region, and that's what the levy can provide. And the lesson of the past is that advocacy from the North East can help secure national action. Together we can get there. More of the same is needed. I won't go through all of this, you've seen it all before, but you in this room are crucial to getting where we need to get to at national level as well as at regional level. And this is my sources of information. Thank you.